First, tobacco control, so all the laws and regulation that have tried to and successfully campaign for tighter control of the tobacco industry. So I think laws around prohibition of smoking in public places, probably one of the best examples of health law that's been successful. I think secondly, probably, and this may be looking to the future a little bit, laws around openness and transparency following medical harm. So we know that last year in England alone, nearly £2 billion was spent on clinical negligence cases, and there's clearly a role there for law and policy to try and encourage greater openness so that cases can be resolved earlier without the need to go to law and to compensate people more efficiently and fairly.
So I think in advising NHS providers as a healthcare lawyer, it's how they resolve what appears to be an unresolvable dilemma about doing more with less. And that's going to require consultation with the public, because it could essentially lead to a fairly dramatic resolution. I think there'll be more mediation. I think there will be alternative means of compensating patients like rapid resolution and redress, but we may have to be more radical than that. We may have to cap damages. People are going to have to make a decision. Do they want to have an NHS, or do they want to be able to sue an NHS?
First of all the important new developments in medical science and research are taking place outside our own borders, around the world, and think only of the example of China's pioneering work in genome editing. Secondly, there are some catastrophic global health emergencies, such as Ebola and Zika, and these are ones that demand coordinated international responses. And lastly, think of individuals at a mundane level who are desperate to get treatment for themselves or say for their children, which they can't get in their own country and which they go abroad to secure. Now, there are obviously international organisations, charters, covenants that deal with health, but law is, in the first instance, the law of individual states and particular jurisdictions. So the question of how law can deal with global problems in health is a pressing one.
I think it's ensuring that as an academic discipline we can continue to play a major role in public engagement and in the education of our students. I think the challenge is that in universities generally there is a move towards much more skills-based training, both for lawyers and doctors, where there'll be less reflection and therefore perhaps less opportunity for scholarship. So I think we've got to become very strong advocates of what we do, why we do, and why we think it's been beneficial in the past.